my name is Sophia. I'm going to be your nursing student today. I'm first going to go through my wipes, and I'm going to wash my hands. Next, I would introduce myself, which I already did. My name is Sophia. I'm going to be your nursing student today, and I'm going to be doing a physical assessment. I would also close the door for privacy or the curtain to my patient's room, and then I would explain the purpose of the physical assessment or the head-to-toe assessment. It's just a quick evaluation to go from the top of your head to the bottom of your feet and go through each of your body systems and to assess your range of motion and ask you a couple questions about your habits and just more information about yourself. Does all that make sense?
Yes.
Good. Okay. So I would also provide patient safety. If their bed was up too high, I would lower it. If they needed the side rails up, I'd put them up. And I would also give you a call bell, so if you needed anything, you'd be able to call for it. The first aspect of this head-to-toe assessment is to do a general survey and to assess the patient's level of consciousness. So, can you tell me your name?
My name is Sophia Boardway.
Lovely. And can you tell me your date of birth?
1104XX.
Good. Would you be okay if I check your bracelet and make sure it matches the chart? 1104XX, Adrian Boardway. Perfect. It matches your patient chart. So, can you also tell me where we are right now?
We're in the hospital.
And can you tell me the day or the time of the year?
I think it's around 8 o'clock. It's November 5th, 2024, and it's Tuesday.
Good. And can you tell me what we're doing today?
We're doing physical assessment.
Good. Based off of her answers, I would say that she's alert and writing times 4 because she's able to answer her name and where we are today and what time it is and also what we're doing. I can also see that she's making good eye contact with me and just doing a quick head-to-toe assessment. Her hair looks healthy, your skin looks clear and clean, your eyes don't have any drainage, your sclera is clear, there's no redness to your eyes, there's no drainage coming from your nose, your oral mucosa looks moist, and your airways are patent in your nose and your mouth, and if I were to look at your ears, there's no wax buildup or anything, so all that's perfect. So next, I would ask my patient a couple questions about their sleep habits. How did you sleep last night?
I slept good.
That's good. And how many hours a night do you generally sleep?
Probably around 5 to 7 hours.
Do you feel like that's enough sleep or that you need to sleep more?
I could probably sleep more.
Okay. And do you ever take any medications to help you sleep?
No.
Okay. The next section would be to assess nutrition. So, how is the food here?
It's good.
How much of your meals do you normally eat?
Mostly all of them.
Okay, so about 75%?
Yeah.
Okay. And would you say that's about the same as what you eat when you're home?
Yes.
Okay, good. And next, I would ask the patient if they have any allergies to medications, foods, or dyes, or any adhesives. Do you have any allergies?
I'm allergic to penicillin. Penicillin and Paclitaxel.
Okay. Can I double check your bracelet to make sure it matches?
What did I say?
Penicillin and Paclitaxel?
Yeah, but first time.
I don't know. Anyway, moving on. So, since we assessed the allergies, next we would move on to vital signs. So, if I were to be doing this assessment in the sim lab on campus, I would be looking at the monitor that's next to the patient's bed. But since I'm home, I'm going to be verbalizing the vital signs. I would have taken them and then I would have compared them to the textbook normal values. So I'd be looking for temperature anywhere between 96.9 to 100.4 degrees Fahrenheit would be normal, and within normal limits, I would be assessing her blood pressure. If it was 120 over 80, that would be within normal limits. A little bit above or a little bit below would also be okay. I would be looking for her heart rate. If it was anywhere from 60 to 100, that would be within normal limits. If it was higher or lower, it would be something that I would have to report. And then I would also be checking her SpO2 levels or oxygen levels. And if it's anywhere between 95 to 100, that would be within normal limits. Next, I would do a quick pain assessment. Do you have any pain anywhere in your body right now?
My back and my shoulders hurt.
Okay. And on a scale of 0 to 10, 0 being no pain and 10 being the worst, what would you rate it?
Probably like a 3.5.
Okay. And when did this pain start?
It's kind of like a chronic thing.
Okay, so it's a chronic condition. And does anything make your pain better or worse, like positioning or anything?
Sitting for too long makes it worse, and if I lay down, it feels better.
Okay. Does your pain radiate anywhere, like from your back? Does it go up or
It's kind
down?
of like my lower back, and it just kind of like goes up to my shoulders.
All right. And did it start getting worse at any time today, or is it always just generally consistent?
Well, I did work earlier today, and I was sitting for a prolonged period of time, so it got worse then.
Okay, that makes sense.